Hi, I'm Gary Bebow. I'm the CEO of WRHS Health System, and this is the October CEO Connection. This month, we are emphasizing the behavioral standard of appearance. You know, appearance has a lot to do with not only how we physically present ourselves through grooming and dress, but also it's a way that we can improve the appearance of the facility and what people see when they come on campus here. So during this month, I think it really would be helpful for us to stress the importance of appearance and see if we can't make a difference. So appearance is a standard. Let's do what we can. Last month, I talked about different initiatives that we're emphasizing right now. And if you recall, I talked about the revenue cycle. I talked about ways to reduce our average length of stay, ways to reduce the supply costs at the hospital, and also how do we improve quality here. I'm beginning my meetings now with the different leaders or different managers of the hospital, and by now I hope that most of you have had the opportunity to give feedback to those directors. I can tell you so far I've had 3 of them as of right now, and boy, the feedback I'm getting has really been excellent. I hope that you'll spend some time thinking about those initiatives, giving your directors the benefit of your thoughts, and in turn, I can receive them as well. Those initiatives really provide some insights into where we can do better in the future, and I think it'll take all of us to be successful. So really help participate in this effort, if you will. One of the things you're reading a lot about in the newspaper and on television is the private option in Arkansas. The private option was made available through the Health Reform Act, whereby people that are near or below the federal poverty level now can gain access to health insurance. For example, in the state of Arkansas, over 200,000 people now have insurance where before the private option they didn't have it. And in Independence County and just the surrounding adjacent counties, over 17,000 people now have insurance through the private option. Now, I can't tell you how important that is to the hospital that we now have a payment source for some of those folks who previously sought health care here, but also more importantly, even than that, is people now have insurance and they now have access to health care that previously they really had to use the emergency room or some other alternatives, or they didn't access healthcare system at all for preventable type illnesses. So the private option is really a good thing. And to make that happen, it takes the support of our local representatives and senators to pass that funding. And so my hat tips to our local representatives. Without the support of them and the other 75% of the representatives and senators of Arkansas, there wouldn't be a private option. And so when you see our representatives and our senator, let them know how much it means to us and how important it is that they continue to support the private option in the future. I want to recognize some staff additions to the WRHS Health System team. In our Drasco clinic, APRN Kathy Maples will start beginning to see patients at the Drasco clinic in October. In addition, DNP Tammy Lusk, who has been the provider at the Drasco clinic, will begin seeing patients at our Cave City clinic. And so welcome those changes to the clinic staffing, and let's do our best to make sure that they're successful in their new roles. I want to bring you up to date on some of the events we have planned in October. October is the Breast Cancer Awareness Month, and on our October 14th presentation in the Ray Rogers Women's Center, Dr. Steve Alexander will make a presentation on breast health. We do that at noon, and so lunch will be served, and I hope if you have a few minutes, you'll come down and support Dr. Alexander and learn from his presentation. In addition, on October 14th, we'll have our Health First in cooperation with First Community Bank at the UACCB. Previously known as Ladies' Night Out, this is our opportunity to showcase some of the services within our community targeted mainly towards women's health. And so as in the past, I really expect to have a great event, and from 4 to 7 on October 14th. If you're available, I hope you'll take a few minutes and drop by and participate in this annual, really important event for WRHS Health System. Finally, I want to recognize the folks who were involved in the September men's prostate screening event. You know, over 325 men went through prostate screening this year, really a record. And boy, it couldn't happen without the help of a lot of folks out of marketing and the foundation and volunteers who drew blood and just orchestrate the event. We did a wonderful job, and I really appreciate everybody's participation in that event. This concludes the October CEO Connection. As in the past, if you have ideas or recommendations how I can make this more effective for you, let us know. You all have a great month.